Hello, everyone. I'd like to introduce Justin Jagosh, who is the director for the Center for Advancement in Realist Evaluation and Synthesis, or CARES, and he's going to give a presentation today. And he's an honorary research associate at the University of Liverpool, and he was a senior research fellow from 2014 to 2017, and now he's a full-time mentor, trainer, and consultant in the realist approach. Up until the pandemic hit us, he was coming to Liverpool from Canada frequently to run realist methodology training workshops, conferences, and summer schools at the Foresight Centre. And he's trained hundreds of people in realist methodology in Liverpool and has organised 2 international conferences on realist methodology in 2014 and 2017. And he's also visiting professor at the University of the West of England. So over to you, Justin.
Okay, Nevin, thank you very much. Thank you to the University of Liverpool Department of Primary Care and Mental Health as well, along with Director Ross White, for encouraging this seminar and informing the content. The title of the seminar today is Philosophy of Causation and COVID-19 Ripple Effects in Primary Care and Mental Health. This is a broad overview of the philosophy of causation, which I hope will give people attending, it will give you a language to improve your thinking and understanding of research design. And then we will talk more about what's happened recently, the abrupt shift in context that has been the global pandemic of 2020 and what that means for research, what it also means for health service architecture, and how we can understand the use of causal thinking in the circumstances we find ourselves in. So that's the idea. I have, I think, 13 slides, not a huge number of slides. My hope is to be able to present this material within 45 minutes or so, and then there will be a chance to have some questions, discussion, feedback. Tremendous amount of expertise out there, research expertise, people working on the front lines who have firsthand experience of changes due to the pandemic and how to negotiate through that. So I hope that this seminar will provide food for thought and a language. I'd like to begin with some question and answer. Okay, so the first question is, why do things happen? And the answer is, they happen due to a cause. Second question, is everything that exists due to a cause? Everything that has manifested, that has a manifested form, also has a cause. It has a reason. So everything that has manifested, everything that exists in some form, in an actual manifestation, in a manifested form, we can assume that there is an accompanying cause to that manifestation. Okay, another question. What is the nature of the cause? Cause exists in the spaces between and within empirical objects. Cause exists in a realm beyond direct empirical capture. I want to push you into a bit of a contemplative mode here. This may not be your sort of everyday way of thinking, but it's necessary to really get into an understanding of the philosophy of causation. You might argue, provocatively, you might argue that cause exists in the spaces between and within empirical objects, and that cause exists in a realm beyond direct empirical capture. It's not easy. So it is not easy, it's not an easy accomplishment to know the nature of the cause of things. So be reassured if you are somebody, a researcher, working to understand the underlying cause of things. It's not an easy task. And I think many people can attest to that. It's not easy, but it's very worthwhile. Okay, here's another question. What is an empirical object? As I have stated in the previous slide, I've used this term empirical object. Well, an empirical object has two parts. One, it has a manifested form, and two, it has properties that can be grasped by our senses and cognition. For something to be called an empirical object, it needs to have those properties that are graspable by our senses, our cognition. We have to be able to grasp, and it also has to have some form. So this can include physical objects, which are the obvious things. That's the first thing you might gravitate to is thinking about an example of a physical object. But it could also be thoughts, emotions, feelings. These are also empirical objects. If they have a manifested form, and we can grasp them. They're tangible in some way. So for our purposes, empirical object, empirical event, you could think of those as synonymous terms. Sometimes an object is more like an event, but that event has a manifested form and it has properties that can be grasped by our senses and our cognition. Like if I give you the example of ultraviolet light has a manifestation. It is a real thing. It exists. But it is not graspable by our senses. Therefore, it is not an empirical object. Unless we develop a tool that enables us to observe ultraviolet light and know its existence, then maybe we can call it an empirical object. So there are many empirical objects that are beyond our natural cognition, but then become empirical objects when we develop tools to investigate and to see beyond what we could otherwise see or know. So that's what I mean by an empirical object. So then what I'm saying is causation lies in the spaces between empirical objects and lies even within empirical objects, because you can granulate those empirical objects to their more atomistic form, their molecular form, and even then we may argue that cause lies in those spaces. So here's another question. Is it possible to know about the manifested world without knowing the underlying causes of such manifestation? And the answer is yes, it is possible, but without knowing the cause of things, that knowledge is vulnerable. So all knowledge is vulnerable, especially knowledge that is not accompanied by an understanding of cause. So the observation of empirical events without an understanding of underlying cause, this is vulnerable knowledge. Maybe it is even dangerous knowledge, because it creates optics. It creates what we may understand as an optical view, which is not the same as a comprehensive view, a holistic view, a realistic view. I was first introduced to this poem, Drowning, Not Waving. If you're in the ocean and you're waving to somebody at shore, are you waving to say hello, or are you waving because you are drowning? If we don't understand the underlying reasons why something is happening, it's dangerous. It can be dangerous. It can be hazardous. That's why causal knowledge is the highest form of knowledge, but it's not easy. There are pathways to a deeper understanding of the manifested world. And so in research, we may think of three main paradigms. Positivist. So positivist uses a counterfactual approach. Realist, using a generative approach. And constructivist, using a descriptive approach. This is I'm trying to create a language here And there is so much more to be said. There's so much more nuance to be had with this conceptualization. So it is a bit soundbite, but maybe it's a way in, a path into a better understanding of research design. So from a positivist approach, we may think counterfactual, which is causation via cross-checking empirical objects. And realist is generative, so that's causation via exploring underpinning mechanisms. And constructivist, which is descriptive, is juxtaposing constructed reality, which may or may not involve causation. So if a constructivist qualitative approach is about analyzing the descriptions of the narratives of interviewees, of participants, beneficiaries, then this may or may not be about causation. But certainly positivist paradigm and realist paradigm is interested in exploring causation, but in different ways. So these are different pathways. So my argument is that we need all of these. We need all of these pathways to try to get to a better understanding of our manifested world. If you think about positivism, you can think about positivism as counterfactual confirmation. Counterfactual cross-checking is ubiquitous in everyday activity and fundamental to cognitive processing. Even outside of formalized research, you can imagine from your own experience that counterfactual thinking is essential to our everyday living. And the example I give of a stolen wallet, say you have your wallet in your back pocket, and then the next minute your wallet is gone. And so there is a cross-checking there. You remembered it was there before, it's not there now. So there must have been an intervention. There was an intervention that happened. Somebody must have taken your wallet. In that way, we are continually moving through the world, surviving in the world, trying to get through our days by counterfactual cross-checking. Is everything as it should be? What has changed? Why has this changed through this counterfactual? Cross-checking empirical objects in formalized research requires volume. This is because such an approach to causation has a confirmatory rather than explanatory frame. So, for example, new medical therapy, is it safe? Is it effective? We want to confirm, yes, it is. Yes, it is safe. Yes, it is effective. This can include counterfactual, so it can include control group, an experiment group, and the comparison of those, or it can include pre-post test or something like that. But we are not able to rely on one case alone. We need multiple, large volume actually, to be able to make a claim about the safety, efficacy, for example, of medical therapies. So positivistic causation in research is limited by the need to reduce complex reality into numerical value for the purpose of high volume cross-checking. So you need high volume cross-checking to make a claim, to make a causal claim. But in order to attain that high volume cross-checking, some reduction of complex reality into numerical value needs to occur. And the question is, what are the consequences of that reduction? And so with counterfactual confirmation, we have to be careful and know when and how it is useful in research process. And finally, counterfactual cross-checking is either synchronous or asynchronous. So it may happen simultaneously, concurrently, in real time, at the same time, control and experiment, or it could happen pre and post test, or pre-pandemic and post-pandemic. You can cross-check, how many people went to the GP before and during and after. pandemic. And that gives you some description, some data, some descriptive epidemiology even. And then where does causation lie from there? There's some causal implication, the role of positivism in causal understanding. If I move to realism and generative explanation, generative causation is about how, why, in what circumstances do empirical objects manifest as they do. So in realist thinking, cause underpins empirical reality, and the iceberg metaphor is a metaphor I've used many, many times, hundreds of times, to explain this, that there is the cause of things under the surface, underpinning reality. So what we see as empirical or empirical objects is like what is above the surface of the water in the metaphor of an iceberg. What the iceberg is above the surface of the water is the empirical object, and that what exists beneath the surface of the water is the cause. There's an underpinning cause. Generative causation is not as ubiquitous in everyday cognitive processing due to the relative difficulty in accessing deeper understandings of the underlying cause of the manifestation of empirical objects. So counterfactual thinking is, in a way, easier. Generative thinking is not so easy. Things are happening, but the reason why, the underpinning reason why things are happening, it's not necessarily apparent. How do you know? How do you find that out? And where do you go to find that? It does happen, but it's not as ubiquitous as counterfactual cross-checking. As formalized in research process, generative causation requires abductive theorizing. Abductive theorizing, for example, you might define it as imagine then evidence sequence. You're trying to imagine why something is, trying to fill in those gaps, those blank spots, because there's no evidence for it. You're trying to imagine it. But then through that imagination, you develop some ideas around research design, research protocol, searching and finding evidence to support that imagination. But that's not an easy task. Do you see what you want to see? How do you know you're not just seeing what you want to see? You've imagined something. How do you know you're not just imposing your imagination on your research process? So this is not an easy task. There's no roadmap for generative understanding. So many people, maybe for very good reason, shy away and say this is too precarious. Generative understanding it's too difficult. It's too unknown. It's too vulnerable to fallibility. But you could argue it's also essential for the resolution of complex problems. So that which is the most difficult may also be the most important. And constructivism, you might call it perspective in relation. So you could first of all say from one moment to the next, our cognition constructs images representing reality. So constructivists highlight this, that we are all constructing our reality, and we are constructing it in different ways based on our positionality in society, for example, our history, our psychology, many reasons. But the key is that we are always constructing our reality. We're not one with the actual truth of things. We are with our constructions. Maybe our constructions are more or less aligned to the truth of things, but we are with our constructions. Juxtaposing constructions of reality provides relational perspective. So it becomes particularly useful to bring multiple perspectives together, multiple narratives, multiple constructions of reality together to adjudicate and compare and contrast. And maybe that results in a higher order thinking or a more ecological view or a multi-perspective view. Constructivism in formalized research is analysis of description. So narrative analysis. People are giving they're describing their experience, they're describing their observations. And so constructivism is an analysis of those descriptions. But this is not synonymous with causation. Description is a precursor to causation because you cannot make assertions about the causal nature of empirical objects if you don't know what those empirical objects are, or you don't know the characteristics of those empirical objects. So description is a fundamental precursor to causation, and constructivism plays an important role here. Constructivism is the analysis of constructed accounts of empirical objects, and causation may remain hidden in such analysis. So there may be causal analysis in the constructivist accounts. That may be the case, but there's no guarantee that that is going to be the case because constructivism is not predominantly focused on causation in the same way that realism and positivism are more focused on causation. Constructivism isn't so focused. That's my take. I'm curious to know. Do you agree? Do you disagree? Please feel free to object. And so you may argue that the growth of causal insight is the development of foresight, hindsight, and insight. So foresight, you could say, is the ability to envision causal impact prospectively, the ability to see into, the future, to predict with accuracy what will happen. Hindsight, the ability to reflect on causal impact retrospectively. So looking back, why did that work? Why didn't that work? And hindsight informs foresight. And to have insight, so insight is all of this together, hindsight and foresight, the ability to perceive the deeper reality involved in causal impact. So if you are a practitioner, if you're a frontline worker, somebody who is really caught in the mix of political decisions and abrupt changes in context and so on, the ability to have insight into every action, everything that is going on, every action you take, every action that others take in the context, the ability to have foresight and hindsight. This is important, and it's getting ever more important as context is becoming more unstable. As we have seen in 2020, context is becoming unstable. And this may not be the end of instability. It may just be the beginning of instability. Hindsight, foresight, and insight are very, very important attributes to cultivate. I'm sure you agree. And thinking about research paradigms, we might argue that counterfactual confirmation, constructed perspectives, and generative explanation as the kind of essence of these three paradigms that I've highlighted. They work together and they work in synergy. We can improve our insight. That's the hope from my perspective. I look forward to your comments. And causation in pandemic-related health service research. So if we pivot here a bit, although keeping the idea of causation still with us, but we pivot a bit, we may say that changes in health service delivery caused by the 2020 global pandemic exemplifies an abrupt rupture in the context of service implementation. I'm sure you will all agree. You probably have your firsthand experience of this. Such rupture has been primarily experienced as restrictions imposed by political public health authorities, obviously for good reason. but these changes we may be able to generally describe, at least initially describe, as restrictions, being restrained, taking away some freedoms, imposing some regulations, new regulations that have never been imposed before and not on such a scale. Restrictions have created a cascading effect on service delivery architecture. And so this cascading effect is changing the context, is changing service delivery architecture, which is also then changing outcomes, it's changing context. There's so much that's happening in the mix, and that's what we need to continue to understand. Many people many researchers who were in the middle of data collection during 2019 and then 2020 hit, and all of a sudden, questions arose. What am I doing? Is this okay? Or what is the relevance of the data I collected? What is the relevance of the data I collected in 2019? What is the relevance of my theories? I had theories of my program in prior to 2020. Are those still relevant? And how should I move forward? I feel very perturbed. No, it's an opportunity to test how keen are your skills in adaptation, iterative adaptation, and developing hindsight and foresight from this experience. How can we see how agile our thinking is to context sensitivity? Can we change things? Can we change our thinking quickly? We need to. We need to develop more agility in our thinking around context, as an example. So what has been your experience? Have you been able to do that? And empirical objects demonstrate their emergent dynamic attributes in times of rapid context change. Otherwise, they appear static, stable entities. So these empirical objects appear static. When everything is going fine, you get the feeling that these are actually quite stable objects. They're static. But during times of rapid context change, when there's a rupture in the context, you see them out. Actually, they're more dynamic. They are more emergent. They're more changeable than you had previously assumed them to be. So that is an insight. That is a gift, really, to realize those attributes of empirical objects. For example, this is not related to the pandemic, but for example, if somebody is experiencing an addiction to cigarettes, addiction to alcohol or cannabis or pornography, or theft or something else. There's so many addictions in the world, many, many addictions. During the time at which somebody has an addiction, there is this feeling of this very static, impenetrable habit. This habit cannot be changed. It is so permanent, so difficult. It's so stubborn. It doesn't want to leave. It won't change. It's very stable. The addiction feels very stable. But then as somebody comes out of an addiction, and what the reasons for recovery are many. They may be maybe because of service delivery, resources of an intervention, but they may be about context, and maybe the cause for recovery is mysterious. Somebody is smoking a pack of cigarettes a day for 10 years, and then one morning they wake up and say, I'm done. I'm done smoking. Today is the day. And they never smoke a single cigarette again. What changed? What was the cause of the cessation of smoking? How do we know the cause? It feels mysterious. There was nothing unusual about the day, nothing unusual about the last year. It was just a moment in time when it was over. Now, that's not how all addictions resolve, but that's an experience. somebody may have that experience, and it's through going through that you realize actually things that you might think of as stable and static are actually more dynamic and emergent. They just haven't manifest. Their dynamic and emergent properties have yet to manifest. So that's a way to understand the causal attributes of empirical objects. Now let me give you an example, another example. Say you have a befriending service to reduce loneliness and isolation. These are real services. They do exist. And isolation and loneliness is a serious problem, and it is growing. So you may have an intervention in which a befriending service matches volunteers to beneficiaries who are experiencing isolation. Befrienders meet with volunteers and they engage in meaningful activities together. Now, of course, there's so much detail to be said about a befriending service. There's so many elements to the befriending service, the matching, whether the volunteers are paid or whether it's unpaid, what the training they receive. There's so many things can be said about a befriending intervention. But what I want to say here is that before the pandemic, before 2020, the intervention took the form of in-person activities. So befrienders meet with their friends, their beneficiary friends. They decide on what to do. Maybe they go for a walk, maybe go to a movie, maybe they play a game of chess or a game of checkers or something. They hang out together, they spend time together, they bond in a way. And there may also be telephone support. Then with restrictions and lockdown, all of a sudden, overnight, the architecture changes. No longer can the home visits happen. And so everything moves to telephone support. Now, if you're a researcher researching befriending, if you're doing an evaluation of befriending services, and you're collecting data up until 2019, and then 2020 hits, what do you do with all that data now that there's a new reality? And it's not clear to what extent the old reality will resume after. How do you understand, how do you make sense of this and the direction you take in data collection? Because after 2020, you might find that what is now the new intervention is telephone and online support. So the intervention moves online and provides exclusive telephone support. You might find that through some data collection after 2020 that there are mixed outcomes in terms of rates of isolation. There are some that have increased feelings of isolation. Others may have decreased isolation because maybe now their family members are at home with them, or they live in a building, maybe they live alone, but they live in a building where everybody is at home now. So that feeling of isolation has changed because everybody is just sitting in their spaces, sitting in their suites, and maybe they're, banging pots at 7 p.m. or they're singing on their balconies, or something has changed in a very unique way that has also changed their feeling of isolation. Maybe somebody feels isolated because they feel everybody else gets to live their life and have mobility, but I can't. But when other people also have their mobility restricted, that changes how I feel about my mobility. Maybe, not necessarily the case, but maybe something like that could happen. So maybe there is an increased feeling of isolation. You can't see your befriender, you can't see your friend. Maybe there's a decreased feeling of isolation. The meaning of isolation may change. And if the meaning of isolation changes, this may have a ripple effect on changing the informal architecture of the program. Because what beneficiaries need has changed. And if their needs change, then maybe the intervention also changes. It adapts informally. Maybe the frontline, the workers, the befrienders start to modify their conversations or their approach. Maybe the visits are more frequent. Online visits twice a week versus in-person visits every 2 weeks or once a week or something. The frequency changes. So then how do you compare? How do you compare? Now, this is the complexity of it. You talk about causation. First of all, we have to understand the changes in the architecture of the program. So we have to understand the descriptive changes and counterfactual confirmation and description of perspective. Those, so the positivist and the constructivist view, those make a significant contribution because we need some general idea of some descriptive epidemiology, for example, to understand what has changed and the nature of the constructs such as isolation, how people make sense of their reality, what has changed. But then the causal understanding, the underpinning cause of things is linked, we can link that back to service architecture. And so there are new causal impacts of the service architecture. And that's where we need to continue to understand. If I give you another example, primary care service architecture. This is actually from an article. Counterfactual study is demonstrating that the 2020 global pandemic has had a significant effect on mental and physical health and a decline in primary care contacts across many conditions. And there's a reference there. This is not surprising. This is what we might expect, that with restrictions, people are hesitant, even though, primary care facilities have been encouraging people to, see your doctor. It's safe. It's, you can. People are scared. People don't want to go to the facilities. People are told to stay at home. So it's people are just doing what they're told, and they're maybe, they're not seeking the care they need. And then similarly, lifting restrictions will be accompanied by a surge in primary care contacts that were suppressed during the time of heightened restrictions. So you have a restriction, you have a suppression of visits, to the doctor and or to healthcare providers, and then once restrictions are lifted, now there might be a surge and an overflow, an overrun of contacts, people coming, seeking appointments, etc. And so causal understanding of this rapid dynamic emergence lies in our insightful view of the ripple effect in the health service architecture. This includes, for example, scheduling and triage innovations, appointment length allocations, patient-provider communication, co-location versus online services, and the emergence of new health professional role boundaries, and so on. So this rupture, this pandemic, creating this rupture in the context, it's created a whole new area of in a way, blind spots in our understanding of the service architecture that we need to understand. We need to understand the causal impact of new architecture. And when we talk about service architecture, not just talking about the well understood aspects, but also those informal aspects that may be what frontline workers do on a day-to-day basis to survive and make things work, even though their supervisors and the funders don't have any idea about what's going on the front line. Those frontline workers are pulling it together. They are bringing their innovative thinking together to make something, to make the system work. And then that becomes service architecture in and of itself. That ground up organic service architecture can be captured. We can understand that. We can theorize it and theorize its causal impact. So I actually just have one more slide, and I will then open it up to discussion, because I hope that all I've done here is just open this door to discussion, and to hear people's experiences and perspectives will be very, very informative. So in conclusion, in research on health service delivery, a right mixing of counterfactual confirmation, analysis of constructive perspectives, and generative explanation provides needed viewpoints to understand the dynamic emergent properties of empirical objects. Such mixing should strengthen hindsight from retrospective reflection and foresight to predict unanticipated ripple effects. For health service architecture, research that can assist in bringing insight into everyday activities can improve the quality of service delivery and outcomes for beneficiaries. So what I'm saying there is that, especially for those working on the front lines who are in that difficult position, that difficult space of trying to figure out how to make things work when the resources are scarce, resources are not meeting demand, how to make things work. Whatever research process can do to inform their view of the system, help them build insight from hindsight and help build foresight. And this is the real benefit of research. We need to harness that and figure out how to improve that translation. Finally, the 2020 global pandemic has tested capacity for foresight, the likes of which we will continue to need and learn from for years to come. So that concludes my presentation. Thank you. And I will turn it over to questions. And I think Ross and Nevin have had a chance to look at the questions maybe.
Yes, I'm trying to look at them now. Perhaps I can start off a question.
Yes, go ahead.
Because no, I completely agree that these mixture of different viewpoints is really valuable in our research, and also depends on the type of research question we have. And of course, our research question often evolves and often changes during the cycle of a research project.
Yeah.
So, for example, I'm interested in developing and testing complex interventions, particularly sort of things like physical activity promotion and rehabilitation, those sort of things. And I've often used these sort of realist methods, these to help develop interventions.
Yeah.
And then tested them using in trials, using sort of these positive, this cross-checking approach, and then used the other like a process evaluation using lots of qualitative methods to sort of understand what the numbers mean. When you get numbers from a trial, then you have to try and work out what the meaning is of these numbers, and then again you can then start thinking about what the trying to work out what the causal mechanism is.
Yes.
Okay. So I get that, and I like the fact that this realist approach is you dissect the evidence and you're pulling it apart. It's nice, it's satisfying. My main query, though, is that sometimes I find the methods impenetrable, and particularly as to what a mechanism is.
Okay.
So that's my particular question would be, how can we make it clearer what the underlying mechanism is using these methods?
Okay, so what a mechanism is. Well, mechanism has been defined differently. But I mean, if you're going deeper, if there's some deeper understanding of the underpinning reason why something exists, then you're moving in the direction of mechanisms. It's not a perfect, tick box, yes, no, this is a mechanism, right or wrong. It's the direction you need to go, the direction you need to understand. So, if you're trying to understand the uptake of an intervention, then the mechanisms have to do with how people feel about the intervention or how people feel about their lives, about themselves. There are so many underpinning mechanisms, underpinning possibilities. So now that's just a very soundbite answer to a mechanism. Does that satisfy your question, or do you still feel that where is the struggle?
Oh, so when I've come up with mechanisms that I think make sense, to other more experienced realist researchers, they said, no, that's not a mechanism.
Okay.
So that's the issue I have with particular realist methods is I find them they can be a little bit impenetrable, sometimes a bit opaque.
Okay. Yeah. And not easy. Generative causation is not easy. Whether it's a mechanism or not, I mean, these are debates, right? And people will have these debates. But if you're going to a deeper understanding beyond the surface level, understanding of things, then you can, from a place of a pragmatic approach to research, think of that as a mechanism. But then maybe it goes even deeper than that. But maybe you don't need to keep going so deep. You can find that spot that is functional, that is useful, pragmatic. If it's important to know that people who experience mental health issues often don't seek help because of a feeling they have, a feeling of shame, for example, then that's the mechanism that is impeding their uptake. But what is the utility of that? So there's a pragmatic goal here, which is, how do you innovate? How do you customize interventions so that they are able to, overcome the barriers, these kinds of, trigger a different mechanism? How can you trigger a different kind of mechanism? That's, if it's useful in that way, then so be it. That's
Mhm.
where we need to go. So Nevin, yeah, I think we could probably talk more at length, looking at your specific examples. Are there other questions? Have people written? I do see that there are some questions in the question box. Let me take a
Oh,
look. Right. Yeah, there's a whole bunch of questions. If you go to the question box, there's a whole bunch of questions.
all right.
Um, right. Yes. Let me take a look at some questions. Yeah. Here's a question somebody asks. Oh, well, I know who asked this question. A very bright person. How can a knowledge of what was before or what is help us to understand what will be? We will never return to what is before. How can we identify what will be the carryover and what will be lost? And some interventions may only work because of the pandemic. Yeah, that's a very good question. And I understand. I understand what you're saying. Some things will never be this. Some things we will never have those. Maybe we'll never have those specific conditions again. And those specific conditions create a specific architecture, program architecture. But one thing is that we we had the opportunity, we still do, it's still ongoing, the opportunity to observe how we respond to context change generally. So maybe the next time the change in the context will be different. If there is an abrupt rupture in the context in the future, maybe it's not exactly the same, but we may develop some foresight into into the prediction of how things will unfold based on our reflection of the abrupt change in context in the current situation. So not all is wasted. Time is not wasted by reflecting on the current situation, because we have to continually be in this reflective mode. We have to be reflecting, looking retrospectively, understanding the causal impact, using this opportunity as practice to view the unintended ripple effects. Because the more you practice seeing it, the easier it starts to become, so that you develop foresight. Not that foresight will always be correct, but that just having foresight gives you something to work with, something that you can start to monitor, more intensely monitor services. There's still so much opportunity for program monitoring and anticipating outcomes. Another question. I love the idea that positivism, constructivism, and realism are three sides of a triangle that together bring the necessary knowledge about the world. What I was wondering about, I always have the feeling that positivism, constructivism, and realism are not only methods to look at the world, but more beliefs and understanding of the world that are fundamentally different from each other and actually kind of exclusive. Either you're a positivist or a realist. I thought that within realism, we can use positivism and constructivism methods because they give a certain understanding of causal explanation. How do you see this? Thank you. I appreciate the astuteness of your question. You've picked up on something I've presented here, which is maybe different from this idea that there are these incompatible paradigms, and then there are these professional boundaries, and there's turf wars, and etc. I find that conversation a dead end, and I find it a bit understimulating as well. That's not to say that there aren't incompatibilities. Yes, there may be incompatibilities. What I would say, my take, is that counterfactual confirmation, as I have coined it, it needs to have its place in complexity theorizing. It is useful. It is important. Counterfactual thinking is important. It's necessary and it's ubiquitous. So it's valid, but it's not necessarily the highest form of knowledge because it doesn't necessarily get to generative explanation. So because generative explanation is so difficult, we may find some symmetry, some compatibility, some overlap between what counterfactual and constructivist perspectives. It's interesting when you think of counterfactual as sort of quant uh, quant data that is pre-post test experimental design, but there's some cross-checking, right? And even in qualitative constructivist view, there's also, it's not necessarily such a strict comparison. Sometimes it is comparison, there's um, case study comparison, for example, but those two kind of qual and quant do have that kind of adding perspective, adding description, but the underlying causal understanding is different, and it may be informed by those paradigms as well. So I ascribe to this idea that we need all three. Obviously, they all exist in full form in our universities, in our research departments, in our activities, so they all have validity. But we have to improve their matching up. We have to match them up so that we can actually create more effective research outputs. And if we think of their contribution to causal understanding, maybe that will help us match them up better. Okay, these questions are great. Okay, I'll copy this. Okay, so the question is this. As constructivist analyses are often narratives rather than just descriptions, do you think there is an implicit view of causation underlying the narrative? You can pull out causal lines of thinking from the narrative. Maybe the interviewee can pull those causal lines out themselves, or through your analyses, you may pull out causal lines, but that's not necessarily the focus. Maybe it should be, or maybe it shouldn't be. There is a certain view in constructivism that is off, causation is off the radar because they're so immersed in trying to understand sort of this ecological holistic view, the thick description of the scene. And that includes everything. So instead of trying to find lines of causation about what is the contribution of that? What is the contribution of that? It's trying to describe all those elements. It's like painting that picture, painting an in-depth picture. And so, yes, I would say that there is always there's a potential for an implicit view of causation underlying the narrative, but not always made explicit in a constructivist view. Sometimes yes, but not always. Good. Okay, we have some more time, just a little bit more time until our session ends. That's right, Nevin, you're good. We can do a few more questions. Okay, I'm going to go to the next question, and I'm just going to copy it as well so that people can see. That's a bit. I am interested to know where you place theory and all that. I mean, does it role change when moving from foresight to insight or hindsight? Well, actually, it's very theoretical. Actually, you can think of this whole terrain of foresight, insight, and hindsight as your theory. Imagine if you have a capacity for foresight, what you have is a capacity for theorizing. Not that that is necessarily, it's not just saying that what I'm thinking is true or it's going to be true. It's that you're theorizing. So in a way, the place of theory is absolutely central in this model that I presented: foresight, insight, hindsight. It is theoretical. If you have an insight about something, another way of saying that is you have a theory about what's going on, and then you're constantly matching that. If you're a manager at a hospital and you're trying to, organize the schedule of surgery operations, you're trying to minimize cancellations, uh, you might have a view that you will predict actually these elements, these problems are emerging, which are going to create this effect. And so it's a theory. It's just still a theory, but it's maybe you haven't even written it down. We have these theories in our heads, these informal theories. These are our hindsight, our insights coming from hindsight and our foresight. It's theoretical. That's Now, if we can explicate those theories, all the better. Explicate them and test them using evidence, all the better. Yeah, very good. Yeah, a few more questions. Another question here. How can the different perspectives be resolved into a single research approach? How to combine positivism, realism, and constructivism? Good question. Maybe you don't necessarily need to combine them in a single approach so that it's like a monolithic research design that encompasses all three. Maybe you have stages, maybe you have work packages, um, or maybe you work in an interdisciplinary kind of department where you have colleagues who are doing some research related in your area that is sort of, it's like a completely separate sort of track of research, but still has relevance and can still inform. So the outputs of one research can inform the other. So some matching up, but how these, I don't necessarily see the need to resolve them into a single research approach. You can do them concurrently or sequentially, and at the same time, maybe some of the realist thinking can inform as I think Nevin has suggested in his work, starting with some explanatory theories and then moving to some counterfactual design, but then also trying to get at the descriptions, the narratives, and confirming those theories in the end. Something along those lines. I mean, that's not out of the question. Oh, there's so much to discuss about that. We could have a whole, day talking about these things. But it's excellent questions. Good. Maybe I can squeeze in one more question. This question says, how would you devise, it's the last one here. How would you devise a research study design that incorporates all three perspectives? Right. It's the same question. you know, but what Nevin described was very interesting, right? Developing explanatory theories, generative causal theory statements at the outset. And those generative causal theory statements, see what they can do is they can inform the development of your quantitative protocols, as opposed to doing, say, a realist study, a realist evaluation where you have realist a realist study design and you have this quant part which is not connected. So the outcomes there cannot be folded into your realist explanatory thinking. That's less ideal. So if you start with explanatory theories and design your quant part with those theories in mind, so you customize those protocols so that you can get quant data that really do inform your theories, your context, mechanism, outcome, configurations, if you are doing a full-scale realist study. And then you may also proceed with qualitative, realist qualitative data collection and analysis. So it's not out of the question, so you can do that. Nevin, any final questions that you see, or any comments from you?
So I know that people are interested in how to bring context more into sort of pragmatic trials, and that
Yes.
so that we start asking implementation questions whilst doing
Yes.
the trial. So I just wonder if you had any final reflections on that, Justin.
Yeah, well, that's a way to optimize the opportunity you have in a pragmatic trial to start bringing in context. My take is that what you bring in as context is going to be shaped by your needs in terms of your what can be accomplished in your trial. But if context has dynamic emergent properties, does it create problems with a pre-post test or control experiment design, because that relies on some kind of assumption of stability of those concepts? And that's sort of where I was trying to get to in the presentation, although maybe I wasn't fully explicit about that, really getting to that point in our understanding, that once you start talking about context, especially from a realist perspective, the nature of a trial and the way it's set up requires some stability. So if you did a trial, say on the befriending service, as the example I gave, if you did a trial and you started data collection in 2019, and then you continued with data collection through the pandemic and into 2021, the nature of context has changed so abruptly that can you rely on the counterfactual approach in the way that the constructs have been pinned down for that kind of reduction to numerical value? Can that continue? Now that's an interesting question, a very challenging question. I don't know, Nevin, do you have any thoughts about that?
Oh, yes, because I mean that's the problem we've all had trying to do these studies in this time, isn't it?
Yeah.
And also trying to well, I suppose it's collecting the numbers, but also describing the context as best we can, and then uh,
Match.
trying to not only describe what's happened, but also see if there's any sort of subgroup analyses or something like that that can help explain some of the differences.
Yes.
Um,
Yes.
but
That,
it's very challenging.
yes. Yes. I understand. I'm with you. I understand. And so subgroup analysis can be a way. It's not. It is restricted in terms of the abductive theorizing you can have around context. There is a sort of more limited view of that, but it can still possibly enhance your trial outputs. There's so much to discuss. Every one of these questions is like a whole new seminar in and of itself. But Nevin, I think we are at time now. So
Yes, so thank you very much, Justin. I think that was very thought-provoking, and I think it'll help us think about deeper research questions when we're thinking in this post-COVID world.
great. Thank you, Nevin. Thanks to everybody for your attendance and your questions. And I hope that this presentation has helped in some
Okay,
way.
we look forward to seeing you back in Liverpool, Justin.
Okay. Thank you very much, Nevin. Take care.
Okay, bye bye now.
Okay. Bye, everyone.